Hi, everyone, and welcome to our on-demand webinar, Responding to COVID-19 with Clinical Communications. Before we begin, I want to start off by saying that we understand what an incredibly difficult time this is for you and your health system. As the world faces this pandemic, your staff is on the front lines. We want to take a moment to first and foremost thank you for everything you're doing for your staff, your patients, and most importantly, each of your communities nationwide. We hope some of the workflow and product tips we will share in the next 15 minutes can help you adapt and, more importantly, leverage your current communication platform as much as possible. So without further ado, let's get started. As we begin, just a quick introduction of the Mobile Heartbeat team today. I'm Kate Clement. I am the Clinical Mobility Specialist here at Mobile Heartbeat, and hopefully my background in tertiary service line operations will help frame up a few of our clinical workflow considerations for your teams. I will pass it off to my colleague, Tyler.
Hey, thanks so much, Kate. Excited to be here and sharing some tips for the webinar today. My name is Tyler Gaiman. I'm the Director of Product Management for Mobile Heartbeat. For those not familiar with product management, what we do is we work with our clinicians and our partners to help solve some of the clinical challenges with the end goal of optimizing our current platform to fit into your current clinical workflows.
Awesome. Thank you, Tyler. We're lucky to have you on the call. So today we're going to cover some of the different ways that your clinical communication platform can help you further support your incident command center, health system, and influx of new patients. Our goal is to help you avoid communication breakdowns, streamline new workflows within your platform, and last but not least, help you provide care and support for your frontline staff. So how are we going to do this and leverage your current clinical communication platform with your current incident command center? Once you've opened your incident command center, one consideration to take is appointing team leaders within Mobile Heartbeat across the enterprise to manage their disciplines and report changes and conditions directly to the incident commander. This could include intensive care, emergency and triage, supply chain, environmental services, security, and even public relations. Now that we've covered that first step, the second is to ensure that everyone can communicate effectively. So how exactly do we do that within Mobile Heartbeat? Tyler is going to walk us through creating dynamic roles to support these new team leads.
That's exactly right, Kate. Dynamic roles are one of the most powerful tools within our platform. And what they allow you to do is create a flexible way to identify different points of contact within your hospital. Now, for our COVID-specific workflows, we have a few examples outlined on the screen here. Some of these could include a COVID supply chain coordinator who's answering questions and facilitating the needs and resources, as well as policies around PPE and equipment usage. A couple other examples are going to be your COVID staffing coordinator or a COVID employee health coordinator who are helping to answer staff questions regarding their shifts as well as their own personal health and well-being. Regardless of your needs around dynamic roles and those specific labels, Mobile Heartbeat has the flexibility to create those within our admin tool as well as assign them phone numbers straight from your existing call management system to create extensions so that your users only need to learn that extension at one time. One last point about creating these dynamic roles is going to be the nomenclature that we use. If we're using COVID for one dynamic role, we want to make sure that we use that for all of the dynamic roles, as opposed to using COVID for some, coronavirus for another, and COVID-19 for others. This helps ensure we're reducing the cognitive load on your staff, and they only need to learn one way of searching for these users. Finding these people is going to become crucial if your hospital is dealing with an influx of patients. So this is one way which you can streamline that discovery to streamline your communication workflows.
Awesome. That's so right, Tyler. The easier we can make it, the better. So now that we have actually coordinated those team leads across the system, everyone is rolling into your incident command center. What can you do to support the influx of these patients? So with the inflow of these patients, you may be exchanging out beds previously dedicated to elective procedures so that you can now receive and treat the surge patients from COVID-19. Some of these units may include your PACU, your OR rooms, or any other units that can become negative pressure rooms if needed. In the event of additional overflow, you might also be creating surge tents or even overflow hospitals within your health system. These triage tents and dedicated triage areas across your campuses will need the same communication capabilities that are seen within the walls of your hospital. Tyler's actually going to walk us through supporting those changes within Mobile Heartbeat by showing us how to create additional rooms, beds, and even campuses for your teams.
Right. So as Kate mentioned, many hospital systems have slowed or even stopped using selective service units and have turned these into triage stations or COVID treatment areas. In this case, on the left-hand side of the screen, you can see that we've renamed some of these units within MHCure. For example, we may have renamed the orthopedic surgic or the PACU to COVID triage or COVID ICU. This help ensures consistency and clarity with the new purpose of these areas. On a similar note, we can rename rooms and beds to provide that same level of clarity. On the other point Kate mentioned, we can create virtual beds in hospitals using our current MHCure and your existing EMR. These virtual beds in hospitals could be used as triage tents to make sure that our nurses and our staff are able to assign themselves to those units, be discoverable by those units, and follow those same protocols. You can do all of this using the exact communication tool that you have and your current EMR, just like you've set up Mobile Heartbeat earlier.
Great. I think that's a great point to make. This is, again, leveraging your clinical communication platform and something that's already in your hospital. So what are we going to do now to really avoid the communication breakdown? So now that we've updated our team leads and created additional bed spaces, our next step is to ensure that the influx of changes do not create communication breakdowns at the time of crisis. As you all know, communication in the time of need is crucial, but the ability to effectively reach the right staff at the right time is paramount. Our first suggestion is to do a super quick communication audit. Who are the individuals in your hospital who currently don't use Mobile Heartbeat that are involved in these new workflows? Some of the additional teams to ensure are included are the triage team, facilities, supply chain, COVID patient intake, telemedicine teams, and EVS and transport. Have you left anyone out who could easily download Mobile Heartbeat on their own device, or better yet, utilize the desktop application if they're stationary? Tyler is going to walk us through how easy it is to utilize the full functionality of Mobile Heartbeat within the desktop application.
Absolutely. And what you mentioned at the top, Kate, there is very important, is we always recognize at Mobile Heartbeat, streamlining communication streamlines our workflows and creates a better experience for everybody involved, not just our patients, but also our staff. And in that mindset, we recognize the challenges of purchasing a whole new set of phones during regular times, let alone during this pandemic. You have to ensure the infrastructure is correct. You've got to provision the phones, make sure users are all set up. What we've created at Mobile Heartbeat is a desktop application that allows you to use the same functionality that you have on those mobile devices, but for users who maybe aren't wandering around the hospital quite as much. So these are going to be people like your security officers, your lab technicians, pharmacy, even the blood bank, those users who are mostly stationary. And this allows them to have that same line of communication that the rest of your staff is using. Specifically during this pandemic, if we need to get blood, we just need to send a message and get it over right away. We don't want that to take too much time. And so what we've created is this desktop application that you can see where your users can utilize that same tool.
Awesome. Thanks, Tyler. So communicating within COVID units can be challenging considering the PPE guidelines for those directly involved with patient care. If a unit is unable to utilize the phones within their COVID unit, like Tyler mentioned, you can consider using the Mobile Heartbeat desktop at any of your workstations on wheels or iPads across the unit. Another area you'll want to ensure has access to Mobile Heartbeat is the bed management and transfer center teams. As the quarterbacks of often across the facility when capacity levels surge, ensuring that they're top-line communicators is essential during this time. And of course, who are those quarterbacks connecting with? The unit teams. Allowing each to have access via their phones and desktops allows seamless communication throughout the system, and more specifically, the COVID units as much as possible. So since this is such a dynamic situation, what about the clinicians who are unavailable and those trying to reach them? I'll turn it over to Tyler, who's going to walk us through the custom status messages to help you aid your staff.
Absolutely, Kate. I'm just going to walk through the basics to answer that question that Kate had around how do we know who is available and who I should message. In MHCure, we've got 3 different statuses, and you can see those represented by the green, orange, and open white circle dot. Green is going to indicate available, which means that I can message this person, and I should probably expect a response back relatively quickly. Second, we have busy, that's that orange dot. That tells me the person is working, they're on shift, but they're busy, their hands are busy. That communication may be delayed. And lastly, we have offline, which tells me this user's not currently working. They're not going to get the message that I send them until they log back in. One of our newer features is going to be on the right-hand side, and it's the ability to add context to that status, and that's custom status message. So in our COVID units, these users are going to be in PPE quite frequently. They're not always going to be able to answer using their phone, but they may want to identify a different point of contact who's going to be handling their messages or their patients in service while they're in that COVID unit. Here, they have the ability to tag which user is going to be taking those messages and provide the context around their status message. So now I know that Monica Nash wants me to direct lines of communication to a different clinician for their service for today. All within the effort of doing exactly what Kate said, streamlining that communication for faster work.
Tyler, that was great. Thank you so much. So as we finish optimizing these workflows around your health system, a few additional considerations for you to keep in mind. So consider using group chat to communicate team decisions with the Incident Command Center. This could include inventory, capacity, surge plans, or any other dynamic communication you want to share. What can drive a real impact is broadcast messages. These can be sent to teams, all charge nurses, all physician leaders, or the entire health system, alerting the right team members of testing updates, lockdowns, all while keeping your current broadcast top of mind for the teams not dedicated to COVID. Your stroke, STEMI, trauma, high-risk OB teams easily communicating through broadcast during this pandemic. As more information populates, keep your staff up to date with real-time links to your system intranet, CDC guidelines, and real-time reference materials. And lastly, updating your staff directory, keeping the most important numbers at the top, utilizing a simple asterisk or adding new numbers to your favorites. Tyler's going to actually walk us through how to do this next.
Yeah, Kate. So I just want to jump into the broadcast feature because it's really powerful to be able to send a mass message to many users all at once with just the click of a button. And the first step to configuring those broadcasts specific for this COVID workflow is just going to be to sit with your clinicians and identify the different workflows that may be applicable for COVID. So some considerations here and the groups that we might want to create are going to be an all COVID staff group. You can see that here, COVID staff. We could have a leadership group around COVID. We could have the COVID command center group. These are all people who I may need to communicate a message to immediately, and it has impacts to their workflow. The second consideration that we're going to want to think through are what are the workflows that are happening either frequently or in an emergent situation. And we'll use a quick broadcast in that situation. What that's going to allow us to do is click a button and send a message to all of the people involved in a workflow around, for example, a room closed for COVID cleaning. We may need to get environmental services over to the room, cleaned, and turn around quickly to deal and handle with that influx of patients. We could do that with a quick broadcast and just a quick click of the button. A couple other considerations for broadcast content could be staffing updates or changes to incident command protocols, PPE usage updates to aid in conserving resources, and any other additional messages you may need to send out to help ensure your staff is taken care of. Kate, I think you got a couple thoughts on that last point.
Yeah, you're so right, Tyler. And just to reiterate Tyler's point, broadcast is wonderful for a health system. The one-to-many communication is absolutely essential and great part of our product and platform. So I'm going to jump to the next step, which is providing care for your caregivers. In order for caregivers to provide the best care, they need to be taken care of themselves. Here are a few ways your team can continue to support the frontline staff during this time. So reminding your staff to sanitize and disinfect their own devices or best practices for infection prevention. Those can be made easily accessible on the home screen. Another one is adding a launch point in Mobile Heartbeat to your COVID-19 mental health hotline, maybe your HR direct dial, or even a childcare facility on campus that's set up for your staff. Anything that can be made readily available for your teams. And lastly, launch points for those manual workflows. One-touch access for facilities, IT on call, any support service available to aid your frontline caregivers that used to maybe be a manual process. One-touch access is essential. Tyler's going to walk us through how easy it is to add those extra launch points for your care team.
That's right, Kate. And I think it's so important. Our platform is so much more than just a communication platform. It's really there to provide resources as well. And to that end, we recognize that your clinicians and your hospital system's focus right now is providing the best care possible. We also recognize the strain that that's putting on your hospital staff and specifically your frontline workers. So we want to help ensure that we're empowering them, not just with communication tools, but also with the resources that they need during this time. And so one of the ways that we've done that is we recognize all the different protocols, procedures, and stress this has put on their life. Really overnight, they've been asked to become experts. And so we've created a couple example launch points that will help them in caring for those patients. The first one that you can see here is going to be a COVID internal FAQ. And that'll just help ensure that your staff has answers to their questions about their needs during this time. The next piece is going to be a link to the CDC website with the COVID questionnaire. This is just going to help caregivers ensure they know all of the new protocols and all the questions they need to be asking their patients. And then finally, we recognize that part of your caregivers taking care of their patients is that they also have an opportunity to take care of themselves. And even something as simple as putting a cafeteria menu as a launch point within Mobile Heartbeat can free them up to look at what do I need to eat today to ensure that I have the stamina and strength to continue caring for my patients for that 8 to 12 hour shift. These are just a couple ideas of launch points you can put within Mobile Heartbeat application to help take care of your caregivers.
That's so right, Tyler. Thank you so much again for joining us today, and more importantly, for everyone's time today during this time of crisis. Our goal is for you to utilize some of these considerations for your team, knowing that each can make a great impact as your team fights this pandemic. Avoiding communication breakdowns, streamlining new workflows within your platform, and last but not least, helping you provide care and support for your frontline staff. We welcome you to connect with us at the email address or cell phone above. Our teams are here 24/7 to support you in your system. Thank you again, everyone, for your time today, and we look forward to seeing you all in person when the storm passes.